Hello and welcome to my channel. In this lecture, we'll continue our talk about the lymphatic system and the series of the cardiovascular system. So let's begin. The structure of the lymphatic system, it's a network of lymphatic vessels, lymphoid organs, and lymphoid tissues, and the circulating lymph between them. They are divided into primary lymphoid organs, secondary lymphoid organs, and tertiary lymphoid organs. The primary lymphoid organs, they are responsible for generating lymphocytes, and example of which is the thymus and the bone marrow. They are involved in production and early selection of lymphocyte tissues. The bone marrow, as you can see here, this is a picture of the bone marrow, is responsible for creation of T cell precursors or progenitor cells and production of maturation of the B cells. So it's responsible for production of both B cells and T cells. Now the B cells, they join the circulatory system and travel to secondary lymphoid organs in search for pathogens, like for example the lymph nodes and the spleen. While the T cells, they travel from the bone marrow to the thymus to continue their maturation in the thymus. The thymus, this is the thymus gland present in the anterior mediastinum. It increases in size from birth in response to antigen stimulation. It's most active during the neonatal and the pre-adolescent period. After that, at puberty, it starts to get atrophied, but continues to the process of the T lymphopoiesis, means the production or maturation of T lymphocytes. Loss or lack deficient thymus in the body results in severe immunodeficiency and so high susceptibility to infection. The thymus consists of lobules divided by septa, made up of epithelium, and so it's considered an epithelial organ, and it's responsible for the T cell maturation, as mentioned before, and undergo a selection process in the thymus, in the thymic cortex, in the cortex of the thymus, before entering the medulla to interact with the epithelial cells. Secondary lymphoid organs, lymph nodes and spleen, are considered secondary lymphoid organs. This is a picture of the spleen. It lies in the left hypochondrium of the body. They are responsible for maintenance and maturation of lymphocytes and initiation of immune response. They are sites of lymphocyte activation by antigens. The spleen, the main functions of the spleen are to produce immune cells to fight antigens, to remove particulate matter and aged blood cells through its red pulp, which is made of spleen sinusoids, mainly acting on the red blood cells, and to produce blood cells during the fetal life. In lower animals, the capsule surrounding the spleen has smooth muscle element in it, and it contracts when the animal exerts an effort, like during hunting, for example. It pumps or adds extra volume of blood to the circulation during the stress situations. Spleen synthesizes antibodies in its white pulp. This is the white pulp of the spleen, and this is the red pulp of the spleen. And it removes antibody-coated bacteria and antibody-coated blood cells. It's a center of activity of the mononuclear phagocyte system or phagocytic system, and its absence causes predisposition to infection. Like the thymus, the spleen has only efferent lymphatic vessels, and the blood supply comes from both the short and gastric arteries and the splenic artery that supply the spleen with the necessary blood for its function. Until the 5th month of prenatal development, the spleen creates red blood cells. It's responsible for hemipoiesis. After birth, the bone marrow takes over and the spleen stops its responsibility in hematopoiesis. It's a central player in the reticular endothelial system, and it produces lymphocytes and also stores red blood cells and lymphocytes, as mentioned before. It can store enough blood cells to help in stresses or emergency, and up to 25% of lymphocytes can be stored in the spleen. Lymph node, this is an example or a drawing of a lymph node. You can see the afferent vessels entering the node in the cortex, and the efferent vessel leaving the node from the hilum. The lymph node is organized collection of lymphoid tissue through which lymph passes on its way back to the blood from the interstitial fluid of the body, of course, and it's present at intervals along the lymphatic system. As mentioned before, it receives its lymph through the afferent vessels and at the periphery that opens into the cortex, and discharges its lymph through the efferent vessel. There are nearly 800 lymph nodes in the human body. About 300 are located in the head and neck. Lymph nodes are present in clusters, especially at the beginning of the limbs. Means in the axilla, for example, for the upper limb, the superficial and deep inguinal lymph nodes at the beginning of the lower limb, and at the neck. Lymph nodes are numerous in the mediastinum, in the chest, neck, pelvis, axilla, inguinal region, and in association with the blood vessels of the intestine. As we'll see later, lymph not only collects lymph from the body, but it's also the main pathway for absorption of lipids. The substance of the lymph, this is a cut section of the lymph node. You can see that it's composed of a cortex. This is the cortex. This is the medulla of the lymph node. And this is the hilum of the lymph node where the efferent vessel leaves. Now, the part of the cortex present directly that surrounds the medulla is called the paracortex. Unlike the cortex, the cortex that has mostly immature T cells or thymocytes, the paracortex has a mixture of immature and mature T cells. So it's the cortex, paracortex, medulla, afferent vessels, and efferent vessel. The lymphocytes in the lymph node are arranged in follicles. The lymph node change their number and size according to the functional state of the lymph node. For example, if there's an antigen, the selection of B lymphocytes occurs in the germinal center of the lymph nodes, which results in the increase in size. It provides an environment for the foreign or antigens to interact with lymphocytes. You can see that in examples like tonsils, Peyer's patches. This is a picture of Peyer's patches of the small intestine, spleen, adenoids, skin, and they all comprise part of the what's so-called the mucosa-associated lymphoid tissue. In the GIT, in addition, there's the appendix that has the mucosa resemble that of the colon, but the heavily infiltrated with lymphocytes, which results in thickening of the wall of the appendix and narrowing of its lumen, and that's why it's liable for obstruction and produce in the case of appendicitis. Tertiary lymphoid organs, these are abnormal lymph node structures or lymph node-like structures that form in the peripheral tissues at sites of chronic inflammation or chronic infection, where there is transplanted organs undergoing graft rejection, and in some cancers and autoimmune related diseases. So they are not present abnormally. Normally, they are present abnormally. They have an important role in the immune response to cancer, and patients with the development of tertiary TLOs has better prognosis than patients with no development of tertiary lymphoid organs, because of course it aids in the immune response against the cancer or the disease occurring at that specific site. Function of the lymphatic system. First, it's responsible for the removal of the interstitial fluid from the tissues, absorbs and transports fatty acids and fats as chylomicrons, and the absorbent is called chyle from the digestive system. Transports white blood cells to and from the lymph nodes into the bones, and the lymph transports antigen presenting cells such as dendritic cells to the lymph nodes where an immune response is stimulated. So it has multiple functions. For example, fat absorption. The main route for lipid absorption after being acted upon by the bile salts secreted by the liver, long chain fatty acids are absorbed to the lymph and in the form of chylomicrons. Then through the thoracic duct of the lymphatic system and through the left subclavian vein into the systemic circulation. In this case, lymph vessels are called lacteals and present at the beginning of the GIT tract, gastrointestinal tract, especially in the small intestine where lipid absorption occurs, and the absorbed material from the GIT is called chyle. Immune function of the lymphatic system. It's the primary site for the cells relating to immune system, including T cells and B cells. By reaction to the antigen and production of antibodies, they play the role in the immune system of the body. and the production of antibodies and cytokines and the recruitment of other immunological cells such as macrophages is an important factor in developing the immunity of the body to foreign invaders. This is a picture of the T lymphocyte, and this is a picture of a B lymphocyte. Clinical significance of the lymphatic system, because the lymphatic drainage of various organs is important in the diagnosis and prognosis and treatment of cancer. Cancer spreads especially by the lymphatic system to the nearby lymph nodes and nearby organs, and this is called metastasis. The intervening lymph nodes can trap the cancer cells. If they are not successful in destroying the cancer cells, the nodes may become sites of secondary tumors, and here you can see the common sites for spread of different types of cancer like lung cancer and breast cancer. See that the metastasis may go to distant parts of the body, where if you obtain a sample of the metastatic tissue, you will find it. For example, metastasis in the brain, you may find a renal tissue present in the brain because the origin of the cancer was cancer kidney or hypernephroma. Lymphadenopathy, it refers to enlarged lymph nodes, as you can see here. Two types of lymphadenopathy: local lymphadenopathy, when a group of lymph nodes is enlarged, and if there is generalized enlargement of lymph nodes, this is called generalized lymphadenopathy. The generalized lymphadenopathy can be caused by infections such as infectious mononucleosis, TB, HIV, and systemic lupus erythematosus, rheumatoid arthritis, means autoimmune diseases, and cancers and metastasis of cancerous cells from other parts of the body. Here you can see evident enlargement of the cervical lymph nodes under the mandible. Also, other type of lymph disease is called lymphedema. It's a swelling caused by accumulation of lymph, as you can see in this limb. This extreme accumulation of lymph form, this is called elephantiasis. The skin becomes thick and the limb becomes swollen and distorted. It may be due to some kind of filariasis or previous infection with filariasis that obstructs the lymphatics of the lymph. Lymph also can occur after surgical removal of lymph nodes in the axilla, for example, in case of breast cancer, or the groin. In the axilla, it causes swelling, and the swelling of the upper limb, and the groin, it causes swelling of the leg. Treatment is by manual lymphatic drainage and compression garments. In case of cancer, it's classified as primary or secondary cancer. Primary means from the lymphatic tissue itself or lymphatic cells series itself. Secondary means the origin is a different tissue in the body that metastasized to the lymphatic tissue. Leukemias, for example, is an example of primary lymphoid cancer. Leukemias and lymphomas, they come from the same progenitor cells or same cell lineage. The lymphoma, it's called lymphoma when it arises in the lymphatic tissue, and leukemia when in the bone marrow. To classify lymphoma, it's classified into Hodgkin and non-Hodgkin lymphoma. Hodgkin lymphoma is characterized by presence of special type of cells, the Reed-Sternberg cell. This is a Reed-Sternberg cell associated with past infection of Epstein-Barr virus. It causes a painless and rubbery lymphadenopathy. The non-Hodgkin lymphoma is a type of cancer characterized by increased proliferation of B cells or T cells, and occurs usually in older age group and than the Hodgkin lymphoma. It has poorer prognosis than Hodgkin lymphoma. Lymphangiosarcoma is a malignant soft tissue tumor, while lymphangioma is a benign tumor occurring in association with Turner syndrome, which is a congenital anomaly. Lymphangioliomyomatosis is a benign tumor of the smooth muscles of the lymphatics that occur in the lungs. Also, another type of cancer, it's called lymphoid leukemia, where the host is devoid of different lymphatic cells. I hope you got the maximum benefit from this lecture, and thank you very much for watching.